Hello and welcome to our YouTube channel Medical Subjects Made Easy. Today's subject is community medicine. Today's topic is question and answers on mumps. 1. What is epidemiology? Study of the distribution and determinants of health-related states or events in specified populations. 2. What are the clinical features of mumps? Fever, headache, body aches, swelling of parotid glands. 3. How is mumps diagnosed in a laboratory? Detection of mumps-specific IgM antibodies or isolation of the virus from saliva or urine samples. 4. What is the treatment for mumps? Supportive care, such as fluids, pain relievers, and warm or cold packs for the swollen glands. 5. How can mumps be prevented? Vaccination with the MMR, measles, mumps, rubella, vaccine. 6. What is the main mode of transmission for mumps? Respiratory droplets from an infected person. 7. Who is at risk of getting mumps? Those who are unvaccinated, have not had mumps before, or have not received 2 doses of the MMR vaccine. 8. How long does it take for mumps symptoms to appear after exposure? Around 14 to 18 days. 9. Can people with mumps transmit the virus if they have no symptoms? Yes, they can still spread the virus to others. 10. What complications can arise from mumps? Orchitis, inflammation of the testicles, meningitis, encephalitis, and deafness. 11. How long are mumps patients contagious? From a few days before the onset of symptoms to about 5 days after the onset of parotitis, swelling of parotid glands. 12. Is there a specific antiviral treatment for mumps? No, there is no specific antiviral treatment for mumps. 13. How effective is the MMR vaccine in preventing mumps? The vaccine is approximately 88% effective after 2 doses. 14. Can mumps be transmitted through sexual contact? Yes, the virus can be transmitted through close or intimate contact. 15. Can mumps be transmitted from a pregnant woman to her baby? There is a low risk of vertical transmission during pregnancy, but it is rare. 16. Can someone get mumps more than once? It is possible, but rare. Having had mumps once usually provides lifelong immunity. 17. What is the incubation period for mumps? The incubation period is typically 16 to 18 days. 18. Are there any long-term effects of mumps? In rare cases, complications can lead to permanent hearing loss or other complications. 19. Can mumps cause infertility? Mumps can rarely cause orchitis, which in some cases can lead to infertility. 20. Is mumps more common in children or adults? Mumps can occur in people of all ages, but it is more common in children and adolescents. 21. Are there any outbreaks of mumps reported recently? Outbreaks of mumps occur sporadically, with some countries reporting increased cases in recent years. 22. How is mumps diagnosed if there is a suspected outbreak? Laboratory testing and surveillance of symptoms are used to confirm cases during outbreaks. 23. Can mumps be prevented through good hygiene practices? Practicing good hand hygiene and respiratory etiquette can help prevent the spread of mumps. 24. Can mumps be spread through contaminated food or water? No, mumps is primarily transmitted through respiratory droplets. 25. Can mumps be transmitted from pets to humans? There is no documented evidence of mumps transmission from pets to humans. 26. What population groups are particularly vulnerable to mumps? Unvaccinated individuals and those with compromised immune systems are more vulnerable. 27. How effective is a single dose of the MMR vaccine in preventing mumps? A single dose of the MMR vaccine provides around 78% protection. 28. Can mumps be prevented in healthcare settings? Yes, healthcare workers should be vaccinated and follow infection control protocols to prevent transmission. 29. Can mumps be more severe in certain age groups? Complications tend to be more common and severe in adolescents and adults. 30. Are there any specific travel advisories related to mumps? There are no specific travel advisories related to mumps. However, travelers should ensure they are up to date on vaccinations. 31. Can mumps cause birth defects if a pregnant woman gets infected? There is no evidence to suggest that mumps infection during pregnancy causes birth defects. 32. Can mumps lead to death? Although rare, complications from mumps can lead to death. 33. Can mumps be used as a biological weapon? While theoretically possible, there have been no known instances of mumps being used as a biological weapon to date.